Okay, so cluster and what's different. Now, there are a lot of people who say they have cluster headaches who don't have cluster headaches. The cluster means they come in clusters, meaning you'll have a week or 2 weeks or a month when they'll just be horrible and then they'll just go away. And then, 6 months, 3 months, a year later they'll come back. So people think of them, and this is kind of the way they can be. So people think if I have a series of headaches and then they come back over another time that they're cluster headaches, but it's more than just that they're separated in time. It's actually some very specific symptoms that when you hear them, you'll see they're very different from a migraine. First off, these are always unilateral, always around the eye, and it feels like an ice pick, right, sticking in right out there. Sometimes it's described as stabbing or burning, but it's a very steady, sharp, really almost excruciatingly painful. And they get a lot of symptoms around the eye. Their eyes will water, they'll get congestion, they get swelling, they may get flushed or hot, which is obviously none of those things are things you see with migraines. So you can start just asking what those other symptoms are. But anything where someone has a one-sided, very steady stabbing pain, I mean not stabbing like a pulsating stabbing, but just like someone just stabbed you with something, then you start thinking about cluster headaches. The other thing is they don't last usually more than 3 hours, so right away you're differentiating them from a regular migraine. Now it's obviously there's complications. You can have a cluster migraine and then it follow with a tension headache, but that the key parts of it shouldn't last more than 3 hours. You can get many a day, and so you can have daily, you can have many a day. They can most come in clusters, but there are people who don't even have that luck. I mean, they'll have them. I mean, they're just absolutely tortured. They just always have them. And they have this strange quality, frequently we call metronomic, meaning they occur at, they may wake you up at 3 every morning or every noon. But they have very sort of circadian rhythm to them.